Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back to the Southern 7 podcast. I'm Shawnna Ryan, and joining me today is Hillary Meisenheimer. She is the Assistant Program Manager for Maternal Child Health here at Southern 7 Health Department. Hillary, thank you so much for your time today.
Thank you, Shawnna.
Oh, I know you're busy. We're going to be talking today about WIC.
Mm-hmm.
And how people can get enrolled in WIC. What is WIC? Tell us about that for starters.
Sure. So WIC is a nutrition program. We are contract through the USDA, so we are a nutrition program. We also provide support, kind of general support for new families. We serve low-income families in our region. We have a clinic and a staff for each of our 7 counties. So we provide food benefits. That's what kind of everybody knows WIC for, is the food benefit package. There's a different package for each different kind of participant that we have. Each kind of family gets kind of a tailored food package for their situation. But we also provide nutrition education, which is something that a lot of these low-income families may not have access to through other programs. Sure, Medicaid covers your pediatrician appointments, your OB appointments, your medical appointments, but they don't always give you that extra nutrition counseling that somebody with a higher income may have access to. So we're just kind of filling that gap so that everybody gets the information and support they need to take care of their families.
Okay, very good. So it's an all-around program?
It is,
for
yeah.
the families that live in our region. Okay, that's great. Now, who does WIC support, or who do they serve? Who falls under that here at Southern 7?
So it's, like I said, low-income families, so we do have an income threshold, but it is any pregnant woman or any child under the age of 5. We also cover postpartum women for a period of time after delivery. It's a little bit different depending on how they're feeding their baby, because breastfeeding mothers need a little extra nutrition support, so they're covered under our program for a little bit longer than women who are not breastfeeding, but they're all covered for a period of time postpartum, just to help them in that recovery period. But yeah, all pregnant women and children under 5.
Okay, great. Now, can anyone receive WIC? I mean, I know there's certain qualifications. Tell us about those.
So we do have income guidelines. Those are available online. They are posted on our Facebook page as well, and I think there's a link on our website to the income qualification. So you can qualify through income. All foster children under age 5 also qualify for WIC, and I believe that it is part of their requirement as foster parents to have their children enrolled in WIC. So we do serve foster families, and then Medicaid's also provides adjunctive eligibility. So if you're a family that's eligible for Medicaid, which a lot of families in our region are, really a large majority of the families in our region are covered under Medicaid, or at least qualified for Medicaid, and those families are immediately eligible for WIC. So, yeah.
So what if you're a family that's already receiving other benefits, such as SNAP, for example?
So SNAP is another program that provides what we call adjunctive eligibility. So that means if you qualify for those programs, you immediately qualify for WIC. You just have to come in and fill out the paperwork and provide a couple of proofs, like proof of identity and residence.
Okay, great. Mm-hmm. Now, you talked a little bit about WIC as far as what people would receive with that, but what are some other services that fall under the WIC program?
So the biggest thing that we're talking about right now, because August is World Breastfeeding Month, we do provide a lot of breastfeeding support. We live in a very rural region, and a lot of our families travel 30 minutes, an hour to get to their healthcare provider. So again, our clinics are just kind of filling that gap to help provide support for breastfeeding families in between their pediatrician and OB visits. So we have breastfeeding peer counselors that are available via text or call 24/7 to our families. They're available outside of office hours if somebody's having an issue or has a question. A lot of times new moms will go to Google. And if you're in the middle of the night, your doctor's office isn't open, it's a really easy way to get information. The tricky thing about breastfeeding information is that everybody has an idea on it, everybody has an opinion on it, and everybody thinks that they're right. So when you participate in our peer counselor program, you have constant access to somebody who has good quality research-based information because that's what we think everybody is entitled to, no matter what their income is, no matter where they live, even when they're rural. You should have access to that good quality information.
Definitely so. Now, as far as WIC being under the umbrella of Southern Seven Health Department, do those mothers, those families have access to other services here at the department?
Sure. So Southern Seven also provides childhood immunizations. We have a Head Start program that's awesome, and WIC and Head Start kind of work together in supporting these new young families. We serve the same kind of demographic as far as income, and I mean, we're all here in the same region, so we're all working with these same families.
And that's what's nice about it, having it under that umbrella, to have all those access and having it each the 7 counties. Now, we know that they have to live in one of the 7 counties to participate in the Southern Seven WIC program. Is that correct?
Yes, that is correct.
What if you've got a family that's coming in from another state? Does the WIC program cross state lines, or does it change?
Absolutely.
How does that work?
Yeah, so there's a WIC program in all of the 50 states. So if you're new to Illinois, if your family's just moved here to our region and you were receiving WIC benefits from another state, just let us know when you call us. We can get in contact with that other agency so that your benefits transfer. So as long as we know before your appointment, ideally let us know when you call to schedule that you are transferring from another state, and we can make sure all of that goes smoothly when we're issuing your benefits for here in Illinois.
Okay, very good. Now, over the last year, and actually the last couple years with COVID, things have kind of had to change a little bit. We've had a lot of curbside service in trying to help the families. Has that changed? Are we still doing a lot of curbside, or what's going on?
So right now we're in kind of a transition period. So like everybody in the world, for the past couple of years, we've all been trying to work around these new guidelines and making sure that everybody is safe and we're not exposing anybody to anything that could be potentially dangerous for their family. Moms and babies, those pregnant women and those new babies, are especially vulnerable. We know that not just for COVID, but any kind of infectious disease. So we've been extra careful with this population. So while some of our other services here at Southern Seven have been in person here for a little while, we've been doing childhood immunizations. Our WIC services, we kind of held back a little bit, but we are starting to do more of those in person just now, just in the past month. So new certification appointments. So the first time we see you, we're going to do that in person. We're going to do a full assessment on your baby. We are going to do height and weight. We're going to do a good, complete nutrition assessment with you, talk to you about what your baby or what your child is eating, what kind of nutritional habits you have in your home, and what kind of goals you have. So we just want to make sure that everybody is getting good support, and offering those in-person services, again, is really enhancing the services that we provide. So.
Well, and the nice thing about WIC and what kind of sets it apart from other programs similar to it is that education for the family.
Exactly.
It's not just coming in and getting your debit card set up and or this and the other. It's more than that. It's helping that child, even, not that you're providing services to them past 5, but they're getting those basic tools that they need to develop and continue that nutrition.
Absolutely,
right?
Yeah. So nutrition is super important, of course, for infants while they're developing, but working with the families and knowing that the parents are getting that support and education early on to continue to provide quality nutrition so that that child continues to develop. I mean, there's research, if you want to look and really get into the weeds, there's lots of research about how WIC helps families and children in the long term.
Okay, very good. Where can people enroll for WIC? How do they get more information on that?
So you can call your local clinic, or you can call here to the main office, and that is 644-2297.
634.
634-2297.
That's okay. We have a lot of phone numbers to remember here.
Yeah, there's a lot of numbers. But if you call that main number, the same number that's in all of our ads that you're probably hearing on the radio, you can call that number and we can get you set up with an appointment. Or if you are already receiving other services at one of our local clinics, you just call that local clinic phone number and we can set you up with an appointment.
Very good. And again, folks, that number was 634-2297, and you can also get that number on our website at southern7.org, or if you have a smartphone, you can download the Southern 7 app and get it from there as well. That'll connect you to where you need to go. So wonderful.
Sure.
Great. Hillary, is there anything else you'd like to share about WIC?
Just that it's a really awesome program that just provides so much for families in this region. And being a rural area, it is hard to access a lot of these services, especially if you have limited income. I mean, we're talking about how COVID hit everybody these past couple years. Access to good food, income, those are all things that everybody's kind of feeling a pinch on. So WIC can really help kind of bridge that gap. I mean, we may not be able to make it totally better, but we can help a little bit, and we can also connect you to other resources so that everybody's getting the help that they need.
Right, and the program changes throughout the year as far as new offerings and things, and that, you know, if there's a new coupon program or something that goes along with that, that changes throughout the year.
Sure.
But as far as accessing, I mean, how do people know if they're a grocery store or their local provider? How do they know if they're on the WIC program to where they can shop there?
Yeah. So most of our local grocery stores have a sign right in the window by the front door saying that they accept WIC. When you come in for your WIC appointment, we also give you a list that has all of the vendors in our region. It has their addresses, the towns that they're located in, and a phone number. So we do want to make sure that you know where you can use your WIC benefits at. Another cool thing that we have going on right now, actually for the summer, is the Farmers Market Nutrition Program. It is running through October. Here in the Southern 7 region, we have a farmers market that happens every Tuesday in Union County. We have a lot of farmers at that market that are accepting our special WIC Farmers Market coupons. So if you're a WIC participant in Union County, or if you're interested in becoming a WIC participant in Union County, we can get you set up with those coupons. You'll get a booklet of 6 $5 checks that you can use at the farmers market, just like cash. The farmers take those and they can cash them just like they were a regular check. So it's supporting our local farmers, and it's helping our families have access to these awesome fresh foods. So yeah,
Wonderful.
It's a really cool program that's happening right now.
Very good. Oh, glad to hear that. And again, when they're calling us, they can get more information about that.
Yeah.
And get that taken care of.
Absolutely.
Wonderful. Anything else? We always have something more. Anything
Yeah,
else?
so I mean, we have a couple of World Breastfeeding Month activities going on. This past week, we just invited a lot of our local healthcare providers to participate in a free continuing education opportunity. So that was hosted by the Lactation Education Consultants. It was made available through Illinois WIC. It was a half-day educational event where they learned about how WIC and our local healthcare providers can partner together to support families in those first week or 2 weeks after delivery. So it's a really crucial time for new families, especially breastfeeding families. So we had that going on this week. We are also working on putting up some more kind of signage in our clinics to make them a little more breastfeeding friendly. We've got these super cute posters that are going to be going up. So if you're coming in for WIC services, take a look around the clinic area, and we have these adorable images of families. They're so cute. You've seen them, right? Like,
oh yeah.
They're adorable.
Yes.
So come and check them out. We are expanding our peer counseling program, so we have gone from 1 peer counselor to 2. I'm working on filling in a 3rd position so that all of our breastfeeding families have that constant support even outside of office hours. With transitioning back to in-person appointments, that gives us another opportunity to work with breastfeeding families. Sometimes it's hard to communicate exactly what's going on with a breastfeeding baby over the phone. So we've really been missing that, but we do have that availability now. So if you're breastfeeding, don't think that WIC is just for formula. We really are about breastfeeding support. Of course, we provide formula to formula feeding families. It is a supplemental program, but we really just want to help each family meet their goals. So if your intention is to breastfeed, or if you're interested in breastfeeding, we want to make sure that you have all the information and support that you need.
Okay, very good. And again, it's not just for moms, it's for dads, it's for grandparents,
Absolutely.
it's for anybody that needs that extra support. Because if you're a first-time parent, it's scary.
It is.
It is so frightening, and to make sure that you're doing everything exactly right, and you guys provide that information, and that's what we want them to know, and to know they have access to. All right, well, Hillary, thank you so much.
Sure.
Appreciate that.
Yeah,
and
thank you.
And for coming and doing the podcast with me. Let's do another one. Let's try to do this pretty often so people stay current on what's going on, especially now that we're kind of on hopefully the downhill slide of COVID. I know COVID has made it kind of difficult. Actually, it's very difficult. To reach families and make sure they get what they need. So it's good to see that things are coming back to somewhat normal.
Yeah, we're getting there. Maybe a new normal, but we're getting there.
But out of all bad things comes something good. So you guys have learned how to navigate and work with your families and get them what they need, even during this time, and that's what's so important and appreciated.
Absolutely.
All right, well, thanks again. You have enjoy the rest of your day.
Thank you.
Appreciate it.
Bye, Shawnna.